So welcome everyone to the fourth installment in our Empowered webinar series. We are going to get started right now. This particular webinar is monitoring SEA, so that is sexual exploitation and abuse risks in organizational processes to create a safer workplace. I'd like to note that this webinar will be recorded, and my name is Harriet. I'm going to be the moderator of this webinar, so you're very welcome. I'm a research consultant at the Global Women's Institute, supporting our work in the East African region. On this webinar, I'll also be joined by my other colleagues from Global Women's Institute, Alina, Lugine, and Jessie, who will be supporting in the background or also in the chat. So please don't be alarmed if you see them responding or sharing any resources within the chat. I'd like to request that you introduce yourselves in the chat, but also use the Q&A function to pose any questions to the panelists who will be able to, address some of the questions during the course of the webinar. So right now, I'd like to briefly introduce you to Empowered Aid.
Good morning.
All right. So before we get to Empowered Aid, the Global Women's Institute, which is based at George Washington University, we specialize in research on violence against women and girls and gender equality by using rigorous and participatory research methods so that we can create a knowledge base to inform programming and policies within the humanitarian and development context. So the Empowered Aid project is seated within the Global Women's Institute as a project there. Next slide, please. So as earlier mentioned, Empowered Aid is a project of the Global Women's Institute that examines the mechanisms through which humanitarian aid is delivered and how these processes may inadvertently increase the risk of sexual exploitation and abuse, or SEA. Just in case you hear us mentioning SEA a lot, we are referring to sexual exploitation and abuse within the affected populations. The goal of Empowered Aid is to support the creation and adaptation of aid delivery models that actively work to reduce power disparities, but also give women and girls a sustained voice in how aid is delivered, because we believe that women and girls are the contextual experts and understand better the realities of and experiences of what they go through. Together with the Global Women's Institute and operational partner agencies, members of the affected populations are guided through the process of identification and prioritization of ways to improve the modalities of how the aid they access is being delivered within their context. Okay, next slide, please. On the screen right there, you can see a little bit of what is on our Empowered Aid website. So I really encourage you to explore our website. Our website has all of the work that we've been doing with the different partners. It has findings and recommendations from the 6 countries that we've been working in. It has lots of tools and resources based on our experience working with the women and girls within the different contexts. We have the online course, which is self-paced and has 5 modules. And participants get to get a certificate at the end of it all. We also have a help desk where different organizations that are interested in getting support from us really use it to reach to us and see the different types of support that we do provide. But also we have our news and events section, where we have a couple of case studies and other resources as well. So my colleagues have shared, or are going to share the link within the chat, so that please feel free to check out our website when you can. Thank you. Next slide, please. So on this slide, I would like for us to zoom in one of the sections on our website, as earlier mentioned, and that is our case study library. The library has examples of how partners have used the aid within real-life projects or within their programs. We have co-authored most of the case studies with the different local and international aid actors who are working in different contexts. The purpose of these case studies really is to help demonstrate how to apply sexual exploitation and abuse risk mitigation measures within a particular program, intentionally right from design, during the process of implementation, but also ongoing monitoring. The library can be found under the tools and resources section of our website. So I really encourage you and welcome you to check it out. All right. So we are absolutely honored to host several panelists, 3 panelists specifically, who are going to be sharing with us their experiences from the different respectful organizations. I will just introduce the panelists, then my colleagues will also share their bios within the chat. Our first panelist is Rima Karim. She is the head of safeguarding and organizational culture at BRAC International, supporting all its entities and operations in Africa and Asia. Rima is a development professional with 14 years experience in the areas of safeguarding, PSEA, gender and diversity, strategic human resource, and project management. Previously, she worked at CARE International in Bangladesh, the World Trade Group in UK, and is now based out of Canada. Our second panelist is called Tinde. Tina heads the Haiti office of the International Federation of Red Cross and Red Crescent National Societies, that is IFRC, and is a deputy head at the Delegation for Cuba, the Dominican Republic, and Haiti. Before taking up this job in 2022 rather, she served 6 months as interagency coordinator for protection from sexual exploitation and abuse at the UN Humanitarian Coordinator's Office in Kyiv, that is Ukraine. From 2016 until deploying to Ukraine, she held different IFRC positions, including as an advisor on PSEA at the Geneva headquarters and heading its cluster delegation in Niger, which also covered Burkina Faso, the Ivory Coast, and Mali. So we can see that before joining the IFRC, Tina served in 2 UN peacekeeping operations in Cambodia and in the former Yugoslavia. She has been a senior advisor in the Norwegian Agency for Development Cooperation, diversity advisor at the Inter-American Development Bank, senior advisor at the Council of the Baltic Sea States, communications advisor at the Norwegian Ministry of Defense, and special advisor on gender issues for the United Nations High Commissioner for Refugees. So you can see the wealth of experience that we have with our panelists. And finally, we shall also get to hear from Emily Galloway. She is a senior technical advisor specializing in protection at Global Communities, with whom she has worked for the past 9 years in humanitarian response. Her experience spans 13 years in various roles, including the United Nations and NGOs, both in global and country teams. In her current role, Emily is responsible for providing technical guidance and research support to protection projects, including in child protection and GPV. She also leads Global Communities Safe and Accountable Programming Strategy, which aims to ensure that our humanitarian assistance projects around the world are accountable to and protect the safety and dignity of crisis-affected individuals, including group protection from sexual exploitation and abuse, accountability to affected populations, do no harm. Emily holds a Bachelor of Arts degree in International Relations and Political Science from Washington University at St. Louis, and a Master's of Peace and Conflict Studies from University of St. Andrews. So you're very welcome, our panelists. And as earlier mentioned, I will be the one moderating this webinar. Next slide, please. All right. So our first question right away is going to Rima. Rima, what are BRAC-specific hiring practices and protections, protections and safeguarding within your work standing operating procedures and general culture that you believe, standard operating procedures and general culture that you believe contribute to a safer workplace? Thank you.
Yep, thank you so much, Hope. I hope you and everyone else can hear me okay.
Yes.
So as BRAC actually has many arms, I'm actually going to speak quite specifically from the perspective of BRAC International, which encompasses BRAC's operations within African Asia regions outside of Bangladesh, which is actually where BRAC originates. So Jesse, if you can help me move on to the next slide. Yeah, so Hope, in response to your question, I'm just going to focus on 3 areas. I'll explore kind of prevention, reporting, and response mechanisms, how safeguarding is incorporated into different procedures, and sort of the overall culture that we're striving towards. So next slide. I'm going to start off by talking about our safeguarding framework. And as you can see at the center there, at its center is a foundation of not only sort of robust policies and procedures, but a culture that our leadership team and our supervisory board are consistently reinforcing. So I think one of the significant factors for me is that every single quarter, when I report up to our supervisory board on how we're doing in terms of PSEA and safeguarding, our progress, milestones, challenges, I receive, very continuous and very practical guidance from them on what more needs to be done to strengthen measures, to have a stronger speak up culture across the organization. And I feel that for me, it's this level of commitment that really kind of helps to uphold our zero tolerance approach. Next slide. So this is just a glimpse of BRAC's DNA for those who are not familiar with the organization. This is just a little bit to show you, how we work and operate. And our goal is to really try and ensure that the do no harm principle is weaved through all of our 8 organizational DNAs. Next slide. Yeah, so if we want to talk about safeguarding culture, I think our organization culture is centered very much on the DNAs that you just saw, our core values. And we are continuously trying to strive for an environment where anybody who works with us, the program participants and communities we serve, they are able to speak out against incidents of harm and abuse without fear of retaliation, which is rooted in power inequality, and able to come forward. And for us, that is very essential to what we feel is safeguarding culture. Next slide. Yeah, so just for context, at BRAC, safeguarding actually encompasses the prevention of sexual harassment, exploitation, and abuse. But in addition to that, other forms of harm. So that ranges from bullying, discrimination, neglect, to non-sexual forms of exploitation. Next slide. So at this point, don't be alarmed by all the text on the screen. I'm just going to speak a little bit about prevention measures. I'll speak on a couple of things I feel are contributing well to this safe environment. One of the things I feel has been helpful is one of the 6 of the safeguarding policies we have in place, which is the whistleblowing policy. And I feel that this has enabled people to come forward to report injustices whenever they've feared risks of retaliation from reporting, for a number of reasons, all of which are very much rooted in power inequality, unfortunately. And I feel this has been helpful in helping us to address key issues. We also have something called a safeguarding audit review that's been happening every quarter for the last 3.5 years. I'll talk a little bit more about this a little bit further down, but it's basically our way of really systematically gathering data and making very targeted improvements in the organization. Next slide. So some of the other stuff that have been really helpful is because BRAC International works in some of the remotest locations in the countries where we work, sometimes where there are no other organizations or even government structures present, doing a lot of frequent field visits and pulse check visits, I feel have been really helpful. Doing different types of messaging, integrating safeguarding in a kind of a standardized way into all proposals. An innovative example of like our messaging was like we have this song about safe and unsafe touch that is sung like a nursery rhyme in Swahili to our ECD program participants who are kind of within the 5-year age range, so that the education starts early and the understanding and protection start early. So yeah, next slide. I just kept all this additional information there if it's helpful for our audience. So here I'm just going to mention that as part of our organizational performance management system, every staff is required to set at least one safeguarding related objective in their annual appraisals. And this is part of, strengthening individual accountability. So here what you have is like KPIs that we have literally written out in detail that people can use as resources that are for leaders. So on this slide, you see examples for leaders. And the next slide, you see similarly examples for individual contributors. So those who are not people managers. And so an example would be something like, say, a leader would need to have a budget, develop a budget to ensure that PSEA training is happening, IC materials are developed. There is a budget for victim and survivor support that can be immediately accessed without delay. And a individual contributor might be sort of implementing those budgets. So this resource is there just so that people don't need to do their own homework. We've given them this information so that they can kind of put this into their annual appraisals and be individually accountable. Next slide. Yeah, so this is just a glimpse of the quarterly safeguarding audit review I was talking about earlier. So we basically use 16 questions that focus on like 4 domains. We gather data on people's knowledge of policies, the reporting channels, how they perceive the working environment, and lastly, their experiences of the reporting and response mechanism. So I know the font is really small there, but question 13 specifically asks respondents, do they feel that the leadership at BRAC drives a safeguarding culture and walks the talk? And, getting this data every quarter and having this data-driven approach, I think has helped us to kind of make targeted improvements, country-specific improvements. Next one. So the next 2 slides, these are just a glimpse for you of some of our organizational SOPs and procedures, like the Safeguarding Risk Management Guideline. This is something we use for program design and implementation. The next slide, you'll see the safe recruitment policy that all of our entities need to follow. We have an SOP for external reporting of SEAH in a structured and uniform way, just because we have very many different entities, and an SOP for humanitarian response that kind of outlines PSEA prevention, response, etc. So I'm almost at the end. In the next slide, Jessie, here, just as part of like our reporting and response, I think some of the significant contributors to a safer workplace is like having multiple committees in place that address reports that are often chaired by the senior most people in the office. We have trained investigators as a pool that we reach out to conduct investigations in SEAH. We have a dedicated annual budget for survivor support. If any person requires, PSS, medical, legal, any other support, there's no delay in getting that provided. And and lastly, something we're trying to do a bit more structured way this year onwards is retaliation data analysis. That's something we've called it. So just following up on fixed periods as per a guideline with victims and survivors to see, are they facing any backlash after case closure? And if yes, what are we going to do about that? So we're trying to do this more meaningfully. So the last slide, the next one, I think what I'll say is that for BRAC International, I think some of our strengths have been about having a large workforce of predominantly women interfacing with program participants, led by a very diverse and gender balanced leadership team, doing large scale programming to reach millions of very diverse people, from very, very small children to adolescent girls and boys to women and men in some of the most remote corners of the world. So I think there's quite a bit of opportunity for us to scale up PSEA outreach. So I'll stop here, Harriet. I'm going to hand it back over to you. And yeah, over from my side.
All right. Thank you so much, Rima, for sharing your experience and BRAC's commitment and how it's intentionally, deliberately woven within the DNA of the organization to make sure that, there's a safe work place created within the organization. Just to remind our participants, please feel free to use the Q&A function of the, or type out if you have any questions when our panelists are making the presentation. Right now, I'd like to turn our focus to Tina, who is, as earlier mentioned, the head of IFRC. Tina, you have done so much work to integrate empowered aid approaches and methods into recruitment and onboarding policies organizationally within IFRC offices. Could you please speak more to what that process has looked like and some triumphs as well as lessons learned that you'd like to share? Thank you.
Yeah, thank you. Thank you so much, Hope, and also a big thank you to Rima for outlining such excellence in sexual misconduct efforts. As we know, there is really no of guidance on these issues, but what we are trying to do is to move mountains. The patriarchal structures of our world, of our countries, whether it's my country, Norway, whether it's Bangladesh or Canada or Niger, they are just really not quite ready yet to fully respect the right of women and children to be safe at all times. So this we can see obviously from reading media reports, etc. But we are really trying. I am very honored to be part of the Empowered Aid Technical Advisors Group for several years now. I am pleased to be here to represent IFRC in this meeting. The IFRC is a federation. It's a small organization, 300 people at headquarters in Geneva. We do have 47 delegations around the world. 13 of these are headed by women. We are trying all the time to increase that number. We are not in charge of national societies of Red Cross and Red Crescent, but we coordinate. And we have statutory meetings. We produce guidelines. We also have emergency response unit teams, and we also bring everybody together in the movement every 2 years, also with the International Committee of the Red Cross to discuss and to adopt principles. And also we are actually, the national societies are auxiliaries to their government in each country, formal auxiliaries in humanitarian situations. So they are called on every time there is an emergency or a situation or hardship. The national societies will step in to help. So of course, it's extremely important that the national societies apply all of the guidelines and policies that they have participated in adopting every 2 years. So what we are doing in terms of safeguarding, of course, the affected people come first. So there has been a lot of focus, as we know in this webinar. We know that the Oxfam scandal and everything, it really stepped up the attention to the importance of safeguarding. So we also have in the movement, we have a resolution, International Conference resolution from 2015, which is on preventing and responding to gender-based violence. And this resolution is binding. And thanks to it, a lot of work started. We have had several types of research done on gender-based violence in emergencies. We are also supporting national societies in developing safeguarding policies, such as on child safeguarding and protection from sexual exploitation and abuse. And you can see on this screen that now 53 out of the 191 have a PSEA policy, and 52 have child safeguarding policies. But as we know, having a policy does not mean that it is automatically funded or implemented. So there are different ways of trying to do this. And of course, as we know, leadership support is crucial. It is also important to use the mandatory requirement to carry out a child safeguarding assessment before each emergency fund is dedicated to a national society. And that is really helping. It is also extremely important to have people to do this kind of work. again, it's not enough to just do an assessment. If you don't have the expertise on board in your national society, or if you are not closely connected to experts in your local community who can do this, then of course it's difficult. So I have put here some examples of, we call it DREF, it's the Disaster Response Emergency Fund. It is a quick access to funding that national societies can get. They actually have to prepare a request for money within 10 days after an emergency has happened. And how they are responding to that in terms of safeguarding, of course, this depends on their existing policies and people who are available. We can move to the next slide. Thank you. And this is a freshly published case study about Liberia Red Cross. And they have done some amazing work to integrate safeguarding into their operations. And here is a list of their recommendations. And what they actually have done has been to hire a safeguarding advisor. They adopted a PSEA policy in 2021. And they have appointed local safeguarding focal points. And they have also done safeguarding work in schools. And there is one quote in this case study. I recommend you to read it. It's just 8 or 9 pages. And there are some good quotes there. Among others, a young girl, 17 years old, she said that thanks to the awareness raising done by the Liberia Red Cross, she then understood better that it was not appropriate for girls to have to sleep with their teacher to improve their grades. So she said that the awareness raising had really helped her and her friends to understand that this was abusive, exploitative, and very negative. So this shows how important it is for the local chapters who are at the community levels to actually have this type of training so that they can bring about this effort in the schools and in their local communities. So I cannot stress enough how important it is for organizations such as BRAC and the National Society who know the culture, who know the availability of clinics. They know if the police station is functioning well or not when it comes to gender-based violence. So I really want to stress that the local knowledge is absolutely crucial if we're going to get anywhere in fighting sexual misconduct. We can go to the next one. So here is more advice from the Liberia Red Cross. Again, I recommend you to look that up. And what is one of their recommendations is to work with the local expertise. And what I appreciate with the Empowered Aid program is not just that it is carrying out research on site about preventing sexual exploitation and abuse in the delivery of humanitarian assistance, but it is also bringing together some of the key players in the world in this effort. And it is producing a lot of very popular training activities. And it is actually encouraging organizations such as the IFRC to take the next step and to hire people who are qualified already to work on safeguarding. So this is something I did when we worked in Niger in 2021. I worked closely with women lawyers and women from the health sector in planning how safeguarding could be carried out through their national society. And without working with these local experts, the program would not be really very useful, because it is the women themselves who know best and who know the capacities in their local environment. We can move to the next. So this is from Niger in 2021. And of course, as we know, survivors of sexual misconduct, they do not necessarily wish or to contact law enforcement. This is entirely up to the survivors themselves, but they could be given information so that they can make an informed decision about what to do. So it is really important for aid actors such as the Red Cross, Red Crescent, national societies, or anyone to be aware of the services that, for instance, law enforcement can offer. So here is a photo from a workshop that colleagues and I organized in Niamey in 2021, where we brought in the head of survivor support unit from the Niger National Police, and behind him stands a man who works at the police academy. So we really were quite happy to have this type of information shared with the national society, because as we know, the survivor and their needs should always come first. And any aid worker should really be aware of what exactly can be offered if something happens. And also most aid workers are locally recruited, but of course there are also international aid workers. And there are examples of international aid workers and national ones who have not received appropriate, adequate response and have even been victim blamed when things have happened. So I'm really calling on the solidarity and the networking of all of us to, in every country where we are, whether we are locally hired or international, that we ask our employers, where is the list of safe, accessible health and legal services, and to really demand this. And some organizations have this, but many do not. And this really is because whether you're local or international, we actually depend on the same services, at least, especially in an emergency phase. We depend on what is already available. And we can go to the next. And this is my last slide. I'm happy to share a photo of Yvonne Muchiri. She did a very good job in it's a training video about the responsibilities of security personnel. They do have, like any staff in any aid organization, they have a responsibility to prevent and respond to sexual misconduct. And what is good about security staff is that many of them have a law enforcement background, and many of them know how to investigate. So my wish is that many more of them will be involved in the PSEA effort. Because I have worked on PSEA for many years, but I have never set foot in a job as a police. And I do not know how to do an analysis of a security risk in the local environment. But this is actually, by definition, it's the work of security officers. So I encourage all of us to engage very closely security officers in all aid organizations in this work. And again, there is a lot of guidance. I really recommend the Gender Inclusion in Security Management. It came out by the UN in 2019. It's absolutely excellent. And I'm still looking for an action plan or any funding of it to be implemented. I know there's good work going on in the UN, and I know there are people in this call from UN agencies, but I would really like to see some evidence online, for instance, about this manual being implemented. I asked about it when I arrived in Ukraine in June or May 2022. I asked 40 male security officers in a call what they are doing to implement the manual, and the head of security answered me and said and asked me to do it. So there you have there's a lack of understanding on how important it is for security officers to be partners in the work on PSEA. So I think that would be the end of my talk today. And also I want to add that since the Red Cross present national societies have a high health profile, and that they are present in emergency situations, and they have a lot of guidance, I've only mentioned a few of them, then I would like to see national societies as a strong resource locally in their chapters with 14 million volunteers and hundreds of thousands of staff. I'd like to see them as local resources in preventing and responding to gender-based violence. Thank you.
Thank you so much, Tinde, for sharing IFRC's experience, as well as emphasizing the need for leadership support, but also recognizing and including the local expertise within the communities where work is being integrated, being done, as well as not forgetting about the security personnel in the work that we do around PSEA. Right now, I'd like to welcome Emily. So Emily, my next question is to you. You have helped to lead a collaboration with Empowered Aid in which you integrated some of Empowered Aid's findings to inform meaningful community engagement in order to understand and address risks that your projects may create or make worse for them. Could you please speak a bit more about the process and whether it's evolved over the past several years? Thank you.
That's great. Thanks. Jesse, you can go to the next slide. So I'm going to speak about a specific case of research that we did in one of our projects. So really looking at the project-specific work that we've done and then how this has impacted some of our broader global strategies. So Global Communities is an international NGO based in the US. We do humanitarian assistance projects as well as development and microfinance. One of our biggest portfolios in humanitarian assistance has been in northern Syria, where we've been since 2015. And within this program, our largest area of work has been in one of the camps in northwest Syria that supports internally displaced people. We have a large program there. We've had it for several years. Two of our biggest areas of work there are protection and water, sanitation, and health. And within this project, we identified, partly through our work and our collaboration with Empowered Aid, that we had a significantly higher risk within our WASH programming. So the Empowered Aid research in Uganda and Lebanon are some of the resources that we looked at. And when we looked at our program there, we realized that through our water trucking services, we had a high potential for SEA. So just to give a bit of explanation about the activity. So within this camp that we work in, we support approximately 180,000 people daily with water. So we are bringing in hundreds of trucks a day to provide water directly to individuals and households. So this is bringing drivers, other contractors into contact with our beneficiaries. And we know we're working in a really vulnerable environment, and we are providing life-saving assistance. So really the risks there are much higher than maybe some of the other contexts or activities that we work with. So we worked with Empowered Aid to adapt some of their tools. Within their participatory action research toolkit, there are focus group discussions, and one of those was specifically on WASH services. So we decided to adapt that tool to specifically the methodology we use of water trucking, and really to get some of the nuances of our activities in our context. So it's one thing to have kind of the broad idea that water services, working in camps, have an increased risk of SEA, but really how can we learn from the women and girls that we're working with specifically to understand their experiences, their concerns, and specifically looking at our feedback mechanism. So that's an area where we've really tried to increase our expertise and our strengths in our different communities and programs. So through this, we were able to leverage both our protection teams who have experience with GBV and engaging with women and girls on sensitive issues, and our WASH teams to implement a number of focus group discussions. One thing that we really wanted to make sure we did was account for different age groups, different demographics within our communities. So we had focus group discussions with different age groups. You can see here some of the different issues that came out from the adolescent girls who were more concerned about their identities being exposed if they were to complain about services or identify risks. Women, adult women were more worried about exploitation specifically when they were accessing services or if they tried to make complaints. And older women over 40, were more concerned about retaliation from camp management or being denied services if they were to raise complaints. So this was really helpful for us to get from them some of their concerns. And we used this information to come up with a number of recommendations, some of them coming specifically from the women. Next slide, Jesse. So there were a number of really interesting things that came out of this. Some of them were things that we're already used to doing. Some of them were a bit new. I'll touch on the first two, which were it came out of the information coming from women and girls that they weren't confident in our ability to keep their feedback confidential. So they were really worried about confidentiality and the information they were sharing. They were also not clear on the option to have anonymous reporting due to the way that we were sharing information about the process. And they weren't sure what happened to the feedback when they submitted it to us. So if they had a concern about our water services, what happens to this? So we worked with both our feedback team as well as our protection and wash teams to do some awareness raising on the process of our feedback mechanism, and emphasizing that this is not just to raise a complaint after something has occurred, but it can really be preventive as well. So we will keep your feedback confidential. You can report anonymously. And this is what happens to your feedback once it's submitted to us. It doesn't go into a black hole. It is not reviewed by the direct implementers of the activity. This is how long it will take for you to get feedback. So this was something that we were really able to do as a response to some of the concerns from the women in the camps. And I will also say that one complication in our camps is that most of our staff are also beneficiaries. So it's a large camp. Most of the staff come from that community. So that's an added layer of complication, concern, level of risk when we're combining staff issues and beneficiary issues. So this was really helpful for, I think, our teams to be able to share more information about what happens to feedback. The last 2 points you'll see there: establish women's safety groups and provide training for truck drivers. These two were a little bit more challenging for us, and we were trying to find ways that we could help implement some of these. Women had recommended that we support them to establish safety groups dealing with much broader issues in the camp. Obviously, there are a lot of security issues beyond the activities that we do. This was one thing they suggested. And then also to provide training on SEA for truck drivers. As I said, we bring in lots of people into the, throughout the community and give them a level of power by allowing them to bring in the water. Both of these we found a bit difficult, partly because of the security situation and the social norms that make it very difficult for us to talk openly about any of these types of sensitive topics. Even within our women and girls safe spaces, we are very restricted sometimes by the camp management and by the community leaders to talk about some things. So we felt that we weren't able to do some of these things. But we did work within our women and girls safe space to improve some of the work here. And we focused on things like having specific numbers on trucks. So if there was a concern with a specific truck driver, they could be easily identifiable, and information about our focus group discussion, our feedback mechanisms. And the feedback mechanism, that is also one thing that we took more broadly to the organization. So we've developed now a policy and very specific practical tools for countries to implement and strengthen their feedback mechanisms. So we have a template as well as an accompanying document that says this is what to consider when you're adapting your feedback mechanism to your context. Nothing, we don't want anything to be cut and paste. We want to make sure that teams are really taking all of these nuances of their specific project into account when they are developing their feedback mechanism. You can go to the next slide. So this is just one example of how we've looked at this at a project level and not just had global guidance that gets, put on a shelf, but we really were working with our teams to do these things. I think have our colleague Julie Weinstock, who implemented much of this assessment online. So she could speak much better to this, but we are focusing more on safe and accountable programming within our humanitarian responses, making sure feedback mechanisms and SAP, formerly protection mainstreaming, are really there from day one. We can't wait until the situation is a little bit calmer, when things are in place. This has to be from the beginning. We're also advocating to include protection activities in all projects. It's not to say that protection teams are responsible for SEA risk mitigation at all, but having these teams in place can help by having people who are experienced with some of these sensitive issues, who can provide guidance and can really support cross-departmental and multi-sectoral approaches. So this was really our WASH team and our protection team in this example, working closely together to benefit both sides. We're also really looking at localized and contextualized approaches. So trying to get away from some of the jargon that we use in our field. I think we all are familiar with all of the terms and the acronyms, but how can we make this accessible to the communities we work with and also to our staff? And I think through this, it's not us teaching, but rather learning. So if we can understand better, and I think this was mentioned by Tina as well, we really need to understand from our teams, you know, what they see as concerns so that we can help them figure out what works best, not to just say, here is our global guidance, go and do, and focusing on understanding rather than knowing. For us, this is not having people memorize definitions or provided training and then they can answer a set of questions. But when they deal with these situations, being able to analyze and respond to that case. The last thing I'll mention is that we are trying to be continuously learning. So we know that we are not able to do everything everywhere, but we really want to focus on identifying the highest risks within our projects, sequencing initiatives. So saying, this is what we can do now, but we know we need to do this, and this later. And this has really been something that our safeguarding team has been working with, setting specific tools at different stages of the project. When you're doing design, when you're doing implementation, here are the risks that you need to consider and helping them adapt based on that. And with our feedback mechanism, as I mentioned, this is something that we're trying to strengthen, not just to close cases, right? We don't want people just to submit their concerns, we address that individual case, we close it, and we're done. We really want it to be proactive, reaching out to communities. Who are we not seeing report into our feedback mechanism? And if we're not hearing from, say, adolescent girls or older women, we need to be reaching out to them and using the information from our feedback mechanisms to adapt programs. Again, not just number of cases closed, but what is our feedback coming in and saying, and how can we use that to improve our programming overall. So I think feedback mechanisms, not the only place to talk about accountability and risk mitigation, but I think a really great tool that we have seen help with our approach to SEA risk mitigation. Thanks.
Thank you so much, Emily, for sharing your experience working, with the women and girls, and also making use of ensuring that, the feedback mechanisms are functional in such a way that the women and girls feel heard. So thank you so much for sharing your question, Francois, within the Q&A chat. I do encourage you, whoever has any questions, please feel free to pose a question to any of the panelists. But I'd like to ask the panelists to share with us the experience, because you've been sharing such wonderful experiences of incorporating some of these risk mitigation measures or practices within your organizational work. I'd like for you to share with us what kind of buy-in or support you needed within your own organization to be able to take some of these proactive measures to address SEA risks within your organization. And for example, what strategies would you recommend for building this support among management or colleagues for those working in organizations where this kind of buy-in or support is lacking?
I'm happy to start. I think one thing that we worked on is getting country leadership buy-in. I think we have been very lucky with most leadership teams being very supportive, but also struggling to prioritize this. And so I think helping them to build this into their existing processes so it's not layered on top of, or it's not seen as something separate, but really integrated with other things. So, this also starts with the proposal stage, making sure that we have the budget for the feedback mechanism and that it's standard. We have a budget for a safe and accountable programming person if necessary. And so I think it's helping them integrate rather than seeing it as a separate thing. And I also think working with the different, working across the different departments to reinforce messaging. So we have, I work specifically on humanitarian assistance and safe and accountable programming. We have our organizational safeguarding. We also have a gender equality and social inclusion team. How can we all work together to be reinforcing messages and also helping each other to message that it's not just us that's doing it, or it's not just our protection team in the field. So I think it's trying to build it into our processes and to work together with whoever has a piece of this in their role to get everybody on board, but definitely a process.
Thanks, Emily. Any other thoughts or experiences?
Hope maybe I'll echo Emily. I think we've had a similar experience, and what's helped is like I was mentioning during my presentation, like having our board and our ELT and our senior leadership team really driving this conversation and championing this has been really helpful. Another thing that I think has been helpful is in every country, whenever we do like discussions around safeguarding, risk mitigation, or risk management for that country, then, it's like colleagues feel like, okay, this is applicable for my country's context and I can relate to this. So I think that helps to get buy-in as well, kind of more at a country office or local level. So these are some of the things I think has been helpful for us.
Thank you so much, Rima, for sharing your experience as well. I don't know, Tina, if you have any final thoughts before we go to the next question from, I see there's a question here.
Yeah, thank you so much. Yeah, I cannot stress enough the need for leadership support. That really sets the tone for any budget, any activity. It is how engaged is the top leadership, whether it is in an international organization or a local organization. And I find that using examples of other organizations that do really well in this area, that is one way to convince leaders, because there's always a need, there's a bit of a competition going on, and I think it's very positive. So also, unfortunately, safeguarding activities are very media driven. There's usually more attention whenever there is a media revelation, exposure of problems, but that should not be how we should work. It should always be knowledge-based, it should be systematic, and it should be funded. So leadership support has been amazing. I met the Secretary Generals of several Southern African national societies, and then when they joined a week-long workshop, that really helped to move the needle in those national societies. So big kudos to them. Thank you.
Thank you so much, Tina, for emphasizing the need for leadership buy-in, really. So before we come to the end of our webinar, there's one final question that has been posed by the Anne Rock in the Q&A. Do you have experience in operations? Oh, no, there's another one, sorry. Thank you so much for this very informative webinar. I'm curious to know whether or how you are able to contextualize SEA training to local contexts. What are the main obstacles or best practices that you have experienced with training localization? I don't know if one of you would like to take this.
I'm happy to go as well, unless Rima and Tina have something burning. I think this has been a really big challenge for us, is to contextualize the training and making sure that what we're sharing is relevant. Like I was saying before, I think having the specific examples that make sense in that context are really important, and doing some ground truthing of our terminology. I think I can't remember the name right now, but there's the website that does translations of different terminologies around SEA, which has been really helpful. But beyond that, I think, what do our communities think of that term? And how can we raise awareness with them without using any of these terms? So if we can give examples that illustrate the points without giving them a definition of something. I think that's really helpful. And working with our teams, we have, safeguarding focal points, having them co-facilitate trainings so that it's not just coming from the global team to provide trainings, but using the resources in country to help provide the training.
Thank you, Emily, for that. I don't know if anyone else has an addition, but we are more than happy to, we have a couple of resources, but also there are so many nice questions. There are a couple of questions that have come up in the chat. We shall be compiling these, and usually what we do is we do respond to these and send them out. So thank you so much for that. We have a couple of resources as well that we do have. So any of you who's really interested in reaching out further to us is welcome to contact us. Yeah, those are our resources. You can reach out on our website. Also, the panelists can also, we shall share their contacts. I think the next slide, we have information on how you can reach the different panelists as well. So please feel free to watch out for that. We have coming up on our Empowered Aid website a couple of, the contextualization guide, which is also connected to the question that we've been asking around contextualizing, different work in different settings, the experiences. We have that coming up. Feel free to check out our website for that, also video explainers. But before we wrap this up, I'd like to ask our panelists if you have anything that you'd like to share that you're focusing on in 2024 or any parting shots for us.
I would like to say that we should focus a lot on networking, exchanging information, because we are all in this call and many, many more working towards the same goal, which is safety for women and children, no matter where we are. And as I mentioned, the services are usually the same, whether you're a local person or an international aid worker. I would also like to encourage all of us to look at the domestic violence issues, because those are also sometimes being shunned or not taken up properly by our employers. And again, the services and the attitudes towards survivors and the societal impact of domestic violence is extremely similar to any other type of violence or sexual violence. ILO has a convention on this, and there's some very good guidance on the International Labour Organization website about this. So those of us working in gender-based violence areas, we can see the similarities, and we just need to push ahead for the application and the funding of these activities across the aid sector. Thank you very much.
Thanks, Tina. Emily or Rima, do you have any parting shots?
Just to say that this work, the moving the needle work, takes a lot out of us personally. It takes a lot of patience. It takes a lot of resilience, and it's good that we have communities like this to lean on each other, learn from each other. So it's wonderful to have participated in this conversation, and I definitely look forward to more similar engagements. But yeah, let us be patient. We are making progress, and we will continue to do so. Thanks.
Thanks very much.
Yeah, just to echo both, I think using what's existing and working together. I mean, all of our tools are collaborations, I would say. We are not creating things from scratch, nor should we be. So, Empowered Aid and all the other organizations that are working hard on this, it's so much appreciated. And yeah, we just hope that we can continue to make changes that will lead us in the right direction. Thanks.
And thank you so much, Emily. And thank you to our panelists. A special thank you so much for sharing with us your experiences in what you're doing in order to, have safe workplaces. And thank you so much to all our participants. Thank you. We've come to the end of our webinar. We really do appreciate your engagement and all the different questions you posed to us. Thank you for creating the time to be with us on this webinar. Have a lovely day, evening, morning, wherever you are. Bye-bye.